In this video, we are going to look at how knee pain occurs. If you are suffering from knee pain, I have some really good news for you. There are literally dozens of ways that it can be managed or even stopped. There are two main causes of knee pain, and the real solution lies in addressing your unique circumstances that are causing the pain. Medicine is generally about treating the symptoms, not in addressing the underlying causes. However, your long-term health really depends on addressing these. Once you understand why you have knee pain, you can then do something about it. There are really only two causes of knee pain. Almost every other factor ultimately comes back to these. Firstly, wear and tear, damage to the joint itself. This is often referred to as osteoarthritis. Secondly, inflammation or swelling of your knee. You will hear this described as rheumatoid arthritis or inflammatory arthritis. However, these two are often interrelated. Excessive wear and tear damage often leads to inflammation, and inflammation can cause joint damage. It's a vicious circle. Your age and exercise are also key factors in knee pain. As we age, we are less able to absorb the nutrients from our food. This, in turn, diminishes your ability to heal and repair your joints and supporting tissues. Excessive exercise, on the other hand, can accelerate wear and tear of your joints. However, it's also true that a lack of exercise can cause arthritis, as it impairs your circulation, which allows toxins to well up in your joints, causing inflammation. Exercise is normally the main culprit in knee pain. It is very easy to exceed your body's repair capabilities, which then starts a downward spiral. These movements can occur at work or during exercise. There are a number of categories that typically lead to these problems. 1. Jarring and compression. These forms of impact particularly apply to the knees, hips, and lower back. Some exercises literally compress a joint beyond its normal load-bearing capacity or range. In order to accommodate compression, the cartilage in your joints is similar to rubber and acts like a shock absorber. It also contains a large amount of water, which acts like a sponge. When a large load is applied, they compress to provide elasticity and absorb the shock. As we get older, 30 plus, our joints progressively contain less water and have less of a buffer against shocks. Many sports that involve jumping or landing hard will have an adverse effect and cause cumulative damage. 2. Repetitive motions. Any movement repeated often and under load causes wear. Once you reach 30, you start to lose the ability to regenerate your joints. If you are participating in hard physical exercise, you are almost certain to get joint wear issues. The key here is to jumpstart your natural repair process. Your body has to be given the appropriate supplements to counter this. It becomes essential to help the body get the best from your diet with the use of more absorbable forms of nutrients. 3. Misalignment. Most people have experienced landing badly or twisting a joint at some point in their lives. Some sports regularly place extreme stresses on our bodies. Rugby, martial arts, and running are probably some of the harshest examples. When your whole body weight is over a misaligned joint, it's highly likely that a serious or long-term injury will occur. Pain around the knee is caused by misalignment of the kneecap, causing too much friction behind the kneecap as it tracks in a groove from the femur to the tibia bone. An expert eye is often needed to spot these misalignments. However, they are obvious when you know what you are looking for. I recently saw a runner who ran like Donald Duck. Every movement was different and their feet were all over the place. This is a guaranteed recipe for disaster and all sorts of knee problems. 4. Overextension. This condition is frequently seen in sports such as tennis and karate, when a joint is stretched beyond its normal limits, damaging the tendons or joints. Hitting a ball repeatedly at full strength or kicking out into the air forces the tendons and ligaments to absorb the shock to protect the joint. Very often the damage done by these exercises shows up several years afterwards. For instance, in China, martial artists would often move from harder forms of kung fu into a softer style, such as Tai Chi, in their early 30s, as their bodies were no longer able to take that sort of damage. These softer styles often contain various exercises that help to heal these injuries. 5. Twisting movements. All of your joints are built to allow movement in particular directions. However, if you over-twist the joint and have most of your weight on it, you are likely to cause damage of either the supporting muscles and/or the joint itself. This is often the worst-case scenario, as it multiplies the effect of the damage. A good example is neck cracking, by twisting your neck to the limit. The cracking noise that results is the damage being caused to your neck and spine. 6. Poor posture and muscular weakness. Much lower back pain is caused by a combination of poor posture such as slouching in a chair at work all day, coupled with weak lower back muscles. Pregnancy can also exacerbate problems as it pulls the spine out of alignment, putting severe stress on the edges of the lower discs, causing abnormal wear and muscular tension. 7. Overuse of the ligaments and tendons. A sudden physical injury, arthritis, overtraining or overworking your knee can cause knee pain. It's not unusual for many of these occur together, which also causes even more damage. A key point is that although you can help your body to repair this damage, you need to avoid the damaging movements that caused the problem in the first place. Carrying on as usual just means that the problem will ultimately come back to haunt you as you get older. As an example, I practiced karate when I was younger and regularly trained many times a week. I ended up with knee problems within 3 years. Fortunately, I realized that karate was causing the problems and made the change to another style of martial art that was renowned for more natural movements. Several months later my knee pain went. Perhaps the best point was made by a friend who is an osteopath. He recently watched a video which mixed cardio exercises with some karate and taekwondo moves. At the end, he shook his head and then muttered, "That will keep me in business for the next 10 years. The majority of his patients come to him with exercise-related problems. Knee problems can be fixed, and it starts with finding what is causing the problem. From there, changes need to be made to either eliminate the problem movements or modify them so that your knees work as intended. We will go into more detail in later videos. I hope you find these tips from Steve's Health Answers really useful, and please let me know how you get on. Please feel free to comment, like this video or subscribe to this channel for more useful videos. Alternatively, visit www.steveshealthanswer.com.